Across the country, United Healthcare is finding innovative ways to deliver our patient-centered care model to the 5% of members who represent the highest need and costs. And with each new market, United Healthcare and Optum work together to consider local cultures, geography, health needs, and provider relationships, and bring a national model to individual members in the community. Mississippi is one of those markets and poses a number of unique challenges. It's in the bottom tier of states in overall health ranking, with high levels of physical inactivity, obesity, diabetes, and infant mortality, and a largely rural population with limited access to care.
Mississippi is very rural, and because of the rural nature of the state, it does allow for some disconnect of our members that are in that area.
One of the state's most prominent physicians, Dr. Shirley, is collaborating with United Healthcare to bring this innovative patient-centered care model to Mississippi.
The challenges in the rural areas are many, one of which is population density. That, coupled with poverty, makes it difficult to recruit the type of healthcare and sustain the type of healthcare that's needed to make a difference.
In Mississippi and elsewhere, our care model helps address the complex health and social challenges of our highest need members. Our care model addresses a member's medical needs, behavioral needs, and social needs, all coordinated by a physician-led multidisciplinary team and supported by a network of community resources. Central to these resources is a network of community health workers established by Dr. Shirley. They find members, build relationships, listen to their needs and concerns, and make sure they receive appropriate, coordinated care.
The community health worker in the model is the key, because the community health worker is a community resident who knows the community. And since the community participates in its selection, it's accepted and trusted by the community.
I love being able to help my community, help the people in my community, and help with all their health issues or any other issues that they may have. Because I understand and I know that some people can't just come to the clinic. They may not have a ride or anything. I'm able to come to their house no matter how far or where is it, I'm gonna get there.
Using the care model and working closely with the community health worker and multidisciplinary team, an Optum care manager coordinates the member's care.
As a practice care manager, I am embedded or housed in a practice in the community. I do outreach with the community health workers in trying to reach members that we have not been able to contact. The community health worker will make contact with that member through their observation, see actually the culture or what's going on with the member at that time. The value that I bring is assisting the member in developing a plan of care that best meets the needs of the patient. With the practice, our focus is driven on meeting our metrics, and having the member come in and meet those metrics is part of our goal.
My son is ADHD. And he has asthma. He's had asthma ever since he was born. The doctor said he was gonna grow out of it, but he hasn't yet. He take albuterol, Pulmicort, Singulair, and at times he have to have the steroid shots. I like the idea of Tenisha coming into my home because she helps me with my son. She helps me plan appointments when I can't get in at the doctor.
It's very important to build trust with the members. Over the phone, they can just hear your voice. Face-to-face, they can see your facial expressions, your smiles, or where you know how your appearance and everything. So it's face-to-face is the best way to go.
I think my son is getting better with the help of Tenisha because he's able to take his medicine and he's able to go to his appointments. He's just much better than when he was at first.
In many ways, the challenges faced in Mississippi are similar to challenges faced by other states that are working to meet complex healthcare needs. In other ways, the challenges here are truly unique. Fortunately, in all cases, when you bring together a commitment to superior care with innovative local thinking, the results are impressive.
This model that we've implemented here, it does set United Healthcare apart. It has allowed United Health Group to serve as a trendsetter in the state. And the partnership with Dr. Shirley, a pioneer that he is, has allowed us to be innovative and provide better care and provide better access to care for our members, especially in those rural parts of the state.
I am convinced that the model that we are implementing, based on what we have accomplished so far, that it can be exported to other parts of rural Mississippi and make a tremendous difference in the health status of the individuals in those communities.